Do you want to find out what the 5 most common mistakes are regarding fertility treatments? Keep watching to learn more. Hi, I'm Dr. Mark Sklar, the fertility expert, and welcome to Fertility TV. This is your YouTube channel dedicated to empowering your fertility. If you want to learn more about how you can work with me privately to improve your fertility, then click the eye icon right here. And now let's get into the 5 most common mistakes regarding fertility treatments. Okay, so number 1 is birth control pills are the answer. I often get patients who email or call me or come into the office saying, I've got this condition and my OBGYN said I need to get on birth control. Answer me this. You're trying to get pregnant. Does anything about the words birth control make sense about taking it right now? No. Is birth control going to get you pregnant? No, because the name tells you it's birth control. It's not designed to get you pregnant. They're recommending it because they think you've got a hormone imbalance and they think that the birth control pill is going to help your imbalance. The reality is it's an easy way and an easy thing for them to give you without having to worry too much about it. But the reality is it's not going to balance your hormones and it's not going to fix anything. And it's certainly not going to get you pregnant. So birth control pills are not the answers. We've got to figure out what's going on and from there create a plan and give you the things that you need to help regulate your hormones or balance your hormones or whatever it is that needs to happen. But birth control pills are not the answer. Number 2, surgery is the cure. Surgery might help. If you've got fibroids, cysts, you've got polyps, there's other issues going on, endometriosis, maybe surgery is going to help, and hopefully it does for a short period of time to give you some space to get pregnant during that period of time. But surgery is not the answer, it's not the cure. It's just a temporary band-aid or solution. I'm not saying it's not useful, I'm saying it's not the only thing that you should be doing. In addition to surgery, we should be treating the underlying issues that are at hand so that way the same problem that you had surgery for doesn't return. So that's number 2. Number 3, you can fix your blocked tubes by having surgery. That goes with number 2, right? So just like in number 2, surgery might help temporarily, but it's not going to fix the problem. The same is true for surgery for blocked tubes. And more often than not, less than 10% of the time, surgery will fix blocked tubes. Usually, blocked tubes are not fixed by surgery or the surgery doesn't last long enough to yield the results that we're looking for. Blocked tubes are difficult to treat regardless. I'm not suggesting that they're an easy thing to treat, but certainly surgery is not the answer in my book. Number 3, meds always work for ovulation. The reality is medications don't always work for ovulation. We think that giving you Clomid or letrozole is going to help you ovulate and get you to ovulate regularly. But more often than not, when patients come in and said, I took Clomid or letrozole, they didn't see a huge change in their ovulation. Maybe they saw it temporarily, but what I often see when they take these meds is that ovulation is much later or much earlier. It's not regular. And then once they get off of it, they're back to where they were before. So it's not really taking care of the problem. And then number 5, IVF is always successful. I say this because I know plenty of patients who go into an IVF cycle thinking that they're going to get pregnant immediately, one cycle, and it's enough. And I'm here to tell you that's not typically the case. Hopefully it is, but more often than not, most patients need 2 or 3 or more IVF cycles to yield the results that they're looking for. So I just want you to go into it with your eyes wide open. So those are the 5 misconceptions or misunderstandings or mistakes or whatever words you want to put on it when it comes to fertility treatments. If you want to learn more about fertility treatments, how to improve your fertility, and what you can do to improve your IVF, then check out my newsletter by going to marksklar.com/newsletter or clicking on the eye icon right here. And remember, you are fertile, you are awesome, and you can get pregnant. If you're trying to get pregnant naturally over the age of 35, watch my Fertility Anti-Aging Masterclass. This is my bulletproof method for fertility anti-aging and to be super fertile over 35. The Fertility Anti-Aging Masterclass is the most comprehensive training for women making babies over 35, and it's free. Click the link below to start watching or click here.